Hi everyone, we're NowPow. Back in 2012, our founder, Dr. Lindau, was frustrated. As a practicing physician and scientist on the south side of Chicago, she knew that her patient's life expectancy was 69 years, but just 8 miles north in the Chicago Loop, that life expectancy was 85. This 16-year gap is not simply clinical. This is because of the social determinants of health, the engagement that these patients have with resources in their area to manage their self-care. And she was frustrated because while she could get near perfect prescription information, she had little to no information about resources in their area to support them after the clinic. Because she knew, as all providers do, that care doesn't just happen in the clinic, it happens in the community. It was out of this need that Dr. Lindau pioneered her idea of e-prescribing community resources. She began a proof of concept project funded by the Center for Medicare and Medicaid Innovation Awards. Over 3 years, she demonstrated across the city of Chicago that when patients received a list of matched resources with the after-visit summary, there was significant reductions in ER and ED utilizations, inpatient admissions, and readmissions. A social referral has power. But when we make these referrals, we're often confronted with the care information gap. Referral senders don't know what resources are in the area or what match their patients' unique barriers to access, and referral receivers can't close the loop. This is where NowPow comes in. NowPow connects the referral senders to the referral receivers, closing that care information gap and catching patients in the middle, bringing community resource networks to life. We are much more than a proof of concept now. We deliver precision population health to our key stakeholders and pick up where platforms like SureScripts are leaving off. Because while SureScripts is doing the work of e-prescribing medication, NowPow is e-prescribing everything else an individual needs to get well, to stay well, and to manage with chronic conditions. We are uniquely well positioned to do this work. Besides having the research of our founder, Dr. Stacey Lindau, we're also at a time of fundamental shift in healthcare today, the change from fee-for-service to pay-for-performance. Our partners are shifting their focus from what happens in the clinic to what happens after the visit itself. And we've been able to grow in just 3.5 years to over 8 states and over 10 geographies with key performance partners in the space. And besides the basic functionality of identifying needs, matching and sharing and tracking referrals, the ultimate value comes in those analytics, because we now have population-level insight, resource supply and demand, and how to elevate your communities in the long term. We're transforming healthcare to address whole person care, because we're NowPow and we believe that knowledge is power. Thank you.